Hi, I'm Dr. Nick Vogelzang. I am a professor of medicine, clinical professor of medicine at UNLV here in Nevada. I formerly was professor at University of Chicago. I am a full-time practicing physician now with Comprehensive Cancer Centers of Nevada and see patients on a daily basis. My practice is limited to mostly genitourinary cancers. I do phase 1 along with my colleagues and will also do lung cancer and a few other solid tumors. I do not do leukemia, lymphoma, breast cancer, brain tumors, head and neck, stuff like that. So I'm pretty limited to solid tumors, focusing on GU and phase 1. So in my world of solid tumor oncology, the impact of the COVID epidemic has really been more social disruption than it has had any effect on medical. The social disruption is simply that many patients are afraid to come in. When they do come in, they're masked and gloved, sometimes excessively. I am wearing a N95 mask when I see patients. That impairs communication. Many of my elderly patients cannot hear me or can't understand some of the words I'm using. So I end up many times just taking the mask off as I communicate, particularly if the patient already has a mask. So it really has had no effect on my practice. Now I'm fortunate I'm in that age group where I don't have to make rounds anymore. My junior colleagues are doing that. And they get to see the patients in the hospital. There's concern about the hospitalization patients. I've had a patient this afternoon who really needed to be in the hospital, has acute renal failure from hypercalcemia, needs a biopsy, and the wife is just panic-stricken about being in the hospital. So I've been trying to manage the patient as an outpatient with fluids and denosumab and steroids, et cetera, and have been successful with that. So these are what I would consider workarounds, mostly because of the societal concerns that the patients and their families are expressing to me. The medical changes that I have implemented have been rather few. I am a little less willing to give chemotherapy during these times. When I would normally give docetaxel to a prostate cancer patient, I may instead use abiraterone. Likewise, with a bladder cancer patient, instead of using a chemotherapy regimen like gemcitabine, cisplatin, I will use a checkpoint inhibitor if I can, such as atezolizumab or pembrolizumab. For the renal cell cancer patients, there's no real change. For the lung cancer patients, they need treatment, and I'm still doing the usual pembrolizumab, methotrexate, cis or carboplatin. Today, I recommended just continuation of a lady on gem carbo. So no major changes in my treatment. And since I don't utilize the hospital very much, I don't worry about neutropenic fevers and such, because my drugs generally are not highly neutropenic producing. Yeah, this is where my my tough love comes into play. I try to explain to patients that the human race has had a long history of plagues, infestations, and epidemics. This is our immune system's ability to fight these off. Yes, every virus, every bacteria, every odd germ has been a scourge on humanity, the worst being AIDS. But, our bodies have adapted in general, and moreover, medical science has adapted. So it takes time. The AIDS epidemic was really treated with antiretroviral therapy. Now we have a highly effective antiretroviral therapy. And the story that I'm hearing with now published about the BTK inhibitors in lymphoma, in leukemia lymphoma therapy, looks like they will be very promising for COVID-induced pneumonia and ARDS. So the therapies that we have and the immunity that the human race has demonstrated repeatedly should give most patients a significant amount of confidence that this is not going to be the end of the world. I had a lady this afternoon whose husband is a retired professor, and I said, don't worry, this is going to pass. And she said, how do you know? How do you know? And I go, ma'am, we have survived Black Death. We have survived Spanish flu. The human immunologic system will allow us to survive. There will be deaths, there will be tragedy, but that is not going to be the end of the human race. And I try to be somewhat optimistic. I try to be somewhat upbeat. I try to be somewhat humorous about it, and try to give people a sense that the hyper anxiety that is ongoing is probably somewhat misplaced. I mean, I remember growing up when polio was terrible, and my brothers and I and sisters and I all had to file in and get our sugar cubes. And yeah, I remember some of my friends getting polio. I remember some of my friends going deaf from measles. And I remember the influenza epidemic in 1987. Those were all terrible things, but the world did not come to an end. The panic that we are experiencing now did not happen back then. Granted, social media wasn't around, communications were not as good, but nonetheless, there was palpable fear about polio. There was palpable fear about measles, and those scourges are now controlled. Just like we have been able to control those scourges, we will, in my opinion, control the COVID virus, and probably sooner than you might think. Well, again, we hear a lot on the news about data, about against to inform our societal decisions. And, collection of data is critical, but interpretation of data is always in the eye of the beholder. Scientists always have bias, whether it be population science, an epidemiologist, even Dr. Fauci comes with, and we all need to recognize that we are, to some extent, biased. We do our best to be scientifically neutral, to be objective, but we all have biases, and the bias is unavoidable. Peer review, publications, all of these help inform us. And as we develop our data, the teaching and education of the patients and their families is vital. We need to be available to the families. We need to be available to the patients. We need to be kind, but we also need to be realistic that there are going to be deaths. There will be tragedies in our lives. And just like cancer tears families apart, so COVID and other epidemics in the past have torn families apart. So wars do that. The nature of our humanity is that there are tragedies every day. And we need to understand that, as painful as it is. We need to explain also that there is hope, that we have overcome these in the past and that we will overcome these now and in the future.